The main reason I implemented cassettes into my office was in our dental school and our residency we had cassettes, and the main reason for us was safety for the staff members, safety for the students and the doctors, and safety for the patients. So for my practice, when I came up here, we didn't have cassettes. I would see routinely they would open the bag and the instruments would just drop through the bags, and we started seeing instruments break, bend, pieces missing, or you didn't know how many instruments you had back in the original bag that you started with. So the main exciting point for us was having the cassettes all together. We didn't have instruments breaking, we didn't have them bending. When we open them up, they're all perfectly aligned in the order that we use them. And more importantly, we knew if something was missing, what it was, and we could replace that.
I really love the cassette system that we're using with Hu-Friedy, and I cannot imagine going back to the old bags that we used in the past. We've actually used them since 2008 when Dr. Drone purchased the practice, and that was one of the very first things that he implemented in the practice.
We started noticing that our instruments were cleaner. We had less people scrubbing instruments.
I don't have to worry about bacteria getting stuck underneath the bands. I'm not worried about stabbing my finger. It's already packaged in one set, ready to go.
Everything is set up. Your instruments are in line, you know exactly where they're going to be. When you're done with them, you put them back in the same alignment, close the tray up, get it out of the rooms.
Using the cassettes has really benefited our office from the time-saving standpoint, in the sense that we can get all of the unsterilized instruments out of the room quickly, and then when we go into the sterilization unit, we can go directly into the sterilization protocols. In the past, you'd have to scrub them, soak them, take them out, dry them, put them in the bag. This is all a one contained system.
We actually have 4 different size cassettes, and so we can go right into the sterilization room. We can look at the size, we know exactly what we're doing, we grab it, pull it out. It's so efficient and so easy. We're not having to go looking through bags and find out what's in here, what's not in here. So everything is very organized and very systematic.
I know all my instruments are right there, and that I'm not getting doubles in some, and some are missing, in other packs. So it's easy. Everything's cut and dry. It's all there.
When we have the patient come into the room, they are now more in tune as to the sterilization protocols in your office. So seeing that cassette all laid out nicely is very effective for patients. We always take them on a tour of our practice, so they always see our state-of-the-art sterilization.
One of Dr. Drone's biggest pet peeves is us getting out of the room and having to go get something.
Well, some people are taking time away from work, their family or whatnot, so when I go into that room, everything needs to be in there start to finish every time.
And so all of the instruments are in there, so there's no getting up and out of the room, and everything's there for the doctor when he needs it. And it also is wonderful for me because I get to stay in the room and have the patient communication.
Our instruments are protected from damage. Well, if they're getting slammed into the countertop or points getting chipped or bent, then they're not going to be as diagnostic tool for you. So for me, the cassettes has allowed us to keep our instrument in amazing shape.
The presentation to the patients is huge, and it's appreciated. So we're very, very happy with Hu-Friedy cassettes.
There are some doctors that may not be wanting to implement this sterilization technique and protocols in their office, and I would say you should give this a try because it's very simple, it's effective, it's safe, and it saves time for your staff, and that's important too, to make sure the staff isn't staying late and having to turn rooms over and then go back and redo the sterilization after hours. And it's probably the best thing out of anything that I bought in my practice, because it's the pinch point in everyone's practice. It's where everything has to start and be sterilized, and it is the flow of getting patients in and out and turning over everything. It's a thing that I would tell any doctor to get the right cassette system. Hu-Friedy's got an amazing product line for any type of specialty, general dentistry, and the cassette system is by far the best way to go.